It's December 2025. We've just finished our annual symposium of the BHP supported program, Right Care, First Time, Where You Live. We brought together 6 of the sites from across Australia that have developed models for youth mental health to take it forward in this country. Those people have worked over the last few years with young people, with communities, with services to genuinely reflect what needs to be done in those areas. We've had a fabulous youth national mental health reference group. They tell us not more, much better, where the health system is sensible, smart, equitable and inclusive. Now what we need to do is work with governments, work with communities. These 6 communities out in Australia are the lighthouse for the future. They show the way forward. We'll work with them. We hope others will join and support that process.
I think Right Care, First Time, Where You Live has been such an amazing development for mental health in the Australian context. You know, the way I've seen it develop over the last few years from, you know, a seed of an idea into literally both a program with all its supporting structures, but actually also the technology and tools that are going to allow people on the front line to do things differently, are going to allow funders and policymakers to make decisions differently. And I think, you know, we will look back from the future at some point and go, thank God that we had, you know, a group of thinkers that came together to do things differently based on evidence that informed the services that we deliver in this country to improve mental health outcomes.
It's very important that this particular project and all of the outcomes that we've seen from it is sustained into the future. Quite often in health policy there are new initiatives, there's a new office created somewhere, and it's not really impacting in the society. That impact requires sustainability, consistency, transparency over a period of time, and I think this is going to be the next challenge.
The modelling is really important to add an additional layer on top of all of the available information that we have at our hands as a commissioning organisation. So we can go much more deeply at a granular level and look at the sorts of interventions that we're putting in place, work alongside people with lived and living experience and young people across our region, and really put in place customised, community-led and local interventions that we are much more likely to be able to see improved results across the community as a result of that.
I've really enjoyed participating in this entire program of work. It's one of the most meaningful lived experience engagement processes I've really been part of. One of the things that really sticks out about this program for me is that not only were young people considered from the beginning of the actual project. In my region, you know, there was a discussion with me before we even really kicked off anything formal. So it was a deeply respectful approach to engaging young people, and every time we've given feedback, particularly when we've championed the particular needs of young people, we felt that feedback was really respected and really heard. And we were also partnered with in a very respectful way. So we were treated as experts within our subject matter. We were given the opportunity to co-author papers about the work. We've been given the opportunity to contribute to media articles about the work, and we're continuing to contribute to this day at every part of the program's development.
I think going onwards, it would be fantastic to see the model used in a lot more like advocacy work. I think it's a fantastic tool to show the benefits of, one, listening to young people who are using services, and two, just the need for funding said services and implementing them in a way that is effective. And I think that involves ongoing youth consultation, just to ensure that the project remains relevant to the communities that they're working with.
I hope that we can actually implement the ideas made in our workshops for all of the 6 regions that are involved, and keep these programs going in the future. And I do hope that in the future more regions can come on board and get themselves modelled and work together to make sure that Australia as a whole's youth mental health system is working for the youth that it needs to support.